Let's talk about your day of surgery. Once your surgery's been scheduled and you have a date, usually about 24 to 48 hours prior to that date, the hospital or surgery center will call you. A nurse will call and go over any medications that you routinely take. Diabetic medications, blood pressure medication, anxiety medication, anything like that. They'll go over, they'll tell you how to take it prior to surgery, whether if they want you to stop it the night before or the morning of surgery. They'll make sure that you haven't smoked for about a month. They'll go over any other medications. A lot of patients are taking weight loss drugs like semaglutides or tirzepatide. You need to stop those at least 1 to 2 weeks prior to your procedure. Phentermine is also another drug that you need to take or stop taking about a week before surgery. They'll go over all of those medications with you. Also, they'll have you make sure that you're not eating or drinking anything after midnight. If you're a smoker, you really do need to stop at least a month prior to any type of surgery. The next day, you'll show up about an hour to an hour and a half at your appointed time. One of the nurses will take you to the pre-op area, and one of the nurses there will then go through all of your past medical history, your past surgical history. Have you had any issues with nausea after anesthesia? Any issues that you've had in the past, so that the OR team and the anesthesiologist can prepare to maybe give you some anti-nausea medication or any other type of medication to help make this a really smooth procedure for you. They'll go over again all of your medications, making sure again you haven't taken your semaglutides or phentermine. The anesthesiologist will then meet with you, go over your airway, talk to you about if you had issues with anesthesia in the past, what they're going to do to remedy that. Following that, I will come in and go over everything as well, go through the consent, mark you, talk about your incisions, go over any other questions that you might have, and then we go into the operating room. Once you're done with your surgery, we'll go together with the anesthesiologist over to the recovery room. We'll do a sign out with the nurses there. The nurses will let you recover. Your family or anybody who brought you can come back and see you when you're a little bit more awake. Typically, somebody takes about an hour to an hour and a half before they're ready to go home. They'll go over all of your post-op instructions, how to care for your dressings, your drains, whether you can shower, any post-op instructions that we might have for you. Also, all of my patients have that information in their packets that our patient care coordinator gives to you prior to going to the operating room. Now, later that afternoon, I call all of my patients from my cell phone, again, going over any questions that you might have now that you're at home post-op, any questions about the medications, about the surgery. We'll talk about, again, what to do over the next few days until I see you back in the office, usually about 3 to 4 days after your surgery.